Hi guys, it's Miss Medic here, and today I'm going to talk about vitamin B12 deficiency. This is a common scenario both in real life and in exam settings. And vitamin B12 deficiency will cause anemia. To be more specific, it will cause a macrocytic megablastic anemia. Macrocytic simply means that the red cells are too big, and I remember this as B is in B12 and B is in big. Megablastic refers to abnormal red cells. B12 is typically found in food of animal origin such as dairy products, meat and seafood. So as you can imagine, vegans and vegetarians run the risk of developing vitamin B12 deficiency. Also, an important substance is intrinsic factor in the absorption of vitamin B12. Intrinsic factor is secreted by gastric parietal cells in the stomach, and it binds to vitamin B12. So intrinsic factor and vitamin B12 together form a complex. This prevents vitamin B12 being broken down in the stomach, so it can then be absorbed in the terminal ileum. Pernicious anemia is an autoimmune disorder where there are antibodies made against intrinsic factor and parietal cells. And this, of course, will affect the absorption of vitamin B12, so patients will end up deficient in vitamin B12. And this typically occurs in older adults as opposed to young adults. We test for pernicious anemia by measuring the level of intrinsic factor antibodies. You can also check for gastric parietal cell antibodies, but these are less commonly done. And other tests you would do is perhaps do a blood film and a reticulocyte count. The treatment of pernicious anemia and indeed vitamin B12 deficiency is hydroxycobalamin, and this is given 3 times a week for 2 weeks and then every 3 months. So you will commonly see hydroxycobalamin on a drug codex, and it's normally every 3 months because patients have been started on this by their GPs or before they came into hospital, so they've already got the loading dose of 3 times a week for 2 weeks. And it is given through the muscle intramuscularly. If a patient is deficient in both folate and vitamin B12, you must treat the vitamin B12 first, as if you don't, it runs the risk of causing neurological problems such as subacute combined degeneration of the spinal cord. So that's important to remember, that if folate and vitamin B12 are both deficient, treat the vitamin B12 first. And symptoms of vitamin B12 deficiency include sore tongue and mouth, the typical symptoms of anemia, palpitations, breathlessness, low energy, and neurological symptoms. And the dorsal column is primarily the column affected, the tract affected by vitamin B12. And of course this column is responsible for vibration and proprioception, so a patient will lose these, or these will be decreased. The patient will also complain of pins and needles, sensation in hands and feet. So that concludes my video on vitamin B12 deficiency. I hope you enjoyed it, and if you did, please don't forget to hit the like button and subscribe for more medical videos.